Health data is becoming more and more accessible with the implementation of wearable devices such as smartwatches and smart rings. And these tools are great for maybe counting steps, tracking heart rate. Our next guest is here to remind you wearables are not replacements for medical professionals. So joining us for more on this and the limits of artificial intelligence is physician and medical director, Dr. Vera Kohut. It's such a pleasure to have you here, doctor. And I was just telling you off camera, very timely, because we see these wearables everywhere. We're very reliant on them. But it seems like there's this balance that we really need to strike with the information and when to maybe get a medical professional to weigh in.
Correct. Thank you for having me this morning, by the way.
When you're talking to some of your patients, is this something that you are seeing more of? People coming in and saying, I noticed this on my watch and I'd like to talk about it?
Absolutely. Wearables are a thing. And we're using it in all age groups, right from youth all the way into the older generation. It's convenient. It's something that can give you data. And we're kind of a data-hungry society. And so we like to have that data. The difference is that data doesn't necessarily always mean that you know exactly what's going on. It's a tool. It flags something. Maybe it's important, maybe it's not. It does need to have some verification from something or someone that can actually interpret that data better.
Maybe we could start by talking about some of the benefits of this technology, because sometimes it can be helpful, especially when it comes to an alert of, oh, something's not right here. I might need to get checked out or talk to my doctor.
Correct. So wearables can be very valuable, for example, in tracking things like heart rates. It can be great in tracking things like your blood sugars. If you're someone that's a diabetic and you're on medication, it may flag when things are too high, too low. When it comes to heart rate, if there are some issues where you're, let's say, having palpitations or irregular heartbeats, it can flag that something isn't quite right, and it give you some idea. Maybe it can be also useful in things like sleep. You're saying you don't sleep, and it gives you some idea of what your sleep patterns are like. So there are some benefits. You can share that data with someone, and a provider, a clinical provider, is who you share it with.
How accurate can it be? And do you have cases where someone comes in and says, you know, I think I'm having heart palpitations or a heart attack or something like that, and that's not necessarily the case?
So a wearable is not a medical device, right? It will take on and it'll track data, but that data isn't necessarily medically acute or astute. So what it does is that it flags a possibility for a discussion. It flags an opportunity to say, I think there's something wrong, and then you bring that data in. We do have medical wearables that are used by physicians and by clinicians, and these are the ones where we are actually tracking things specifically, like wearable data for people who have heart disease, and we're tracking their heart rates, or we're tracking things like congestive heart failure, etc. These are medical grade. Okay, they are a scientifically proven device that is accurate and usable versus something that is giving us information but doesn't have that level of accuracy and scientific backup.
I understand there's even certain symptoms that can be misdiagnosed based on a wearable versus what you might see as a physician.
Yes. So, for example, if I'm feeling very anxious, my heart rate will go up, right? And so the wearable will identify that your heart rate is up. It doesn't do anything else. It just says that your heart rate is up, okay? Or, for example, let's say you're asleep and your heart rate drops off, or you're very fit and your heart rate is really low. These are not necessarily signals that there's something catastrophic or bad going on. This is just information that a device is telling you. It can tell you to get up and start walking around because you've been spending too much of your time sitting. And so again, it's a reminder, it's a tool. It's not a definitive.
Yeah. What's your advice then for somebody who has the information on their watch, their ring, whatever it is, and they're going, should I just take this for what it is, or should I call my doctor?
I think anytime you have data that you are receiving and it causes you to feel like, I don't know what to do with this, is this important, is it not important, I think you should check it with your provider. I mean, I think you should also understand that there may be resources you can check even online to see whether or not this is, you know, something to think about or not. Those resources are things like the Mayo Clinic, the National Institute of Health, Johns Hopkins, you know, even the College of Family Practice. There are places to go to really fact check things versus just turning around and accepting it. And if you are going to see a provider, let them know that you've actually looked at data and said, you know, I was using my, you know, Apple Watch or what I was my Fitbit, and it said that.
Yeah. That's great for the doctor to know,
now
right?
Start a conversation.
Certainly. Doctor, thank you so much. This is such an important conversation right now, so we appreciate your time talking to us.
Thanks very much. It was a pleasure.